What we want to talk about today is the processes of how we get to somewhere with Medicare for All. A lot has happened in the last couple of years. A lot of grassroots work has been done. A lot of advocacy work has been done. I think anybody has to concede that Bernie Sanders' campaign in 2016 made a real dramatic difference in terms of moving Medicare for All into the mainstream of the discussion. It's always been kind of looked at as, oh, well, that's out there on the fringe and so on. It's not something that that serious people at the national level talk about it. If national level pundits have talked about Medicare for All, it's only been to make fun of it. Those are, there's been some real positive movement, but along with that positive movement, of course, is a strengthening and a hardening of the resistance. We know that some enormously wealthy and powerful industries stand to lose a lot, the pharmaceutical industry and the insurance industry most notably. How do we overcome that? What's some of the kind of work that will help us to overcome that kind of resistance?
So when David asked me to come hang out with you folks today, I thought, what can I bring to them? What can I show up at the table with that would help them in their mission? Because you folks know as much about the benefits and the why behind what we're fighting for as I do. And then I had an epiphany last week, as I want to do on occasion. So I'm back at my job full-time working, and I was working on a course that we were building out for the World Health Organization about how to advocate for UHC, Universal Healthcare 2030. And I was like, well, hey, maybe I could tell them some of the things that I'm working on in this course. Maybe we could talk about that. And so my thoughts around this are really how we can advocate for it. And that, I think, gets to David's question, which is how do we combat the resistance? And we combat this resistance from these powerful groups with so much human political will that it cannot be denied, right? And we've seen that growing and growing and growing. But still, in the 11 counties that you folks represent, a lot of times when you go out there and you start talking about Medicare for All, or you start talking about single payer, you hear things like, it's a government takeover of healthcare, right? Raise your hand if you've heard that. Everybody. It's gonna bankrupt our entire country. Raise your hand if you've heard that. And then I want you to think really seriously for a second about what you say when people say that. The one thing that I know for sure about changing people's behaviors and mindsets is that facts, coming to them with facts, that doesn't change behavior and mindset, right? And so what we do to change behavior and mindset, how we create this political will, is by either giving people experiences and then guiding them through reflections, or by doing that with a story and then asking them questions, right? People's minds are changed about things when they're talking, not when they're listening. There's 3 things I want you to remember. When we're talking about this super, super important issue, we've got to tailor our message to our audience, right? So any educators in the room, I see you already nodding your head, right? The first thing we think about is, who is this person that I'm talking to and what do they need to hear, right? And the second thing I want you to think about is that there is not a more personal issue than healthcare for people, right? This deeply touches everyone on a personal, visceral level. Everyone has had a healthcare experience from themselves or their loved one that makes this so, so personal. And you just gotta tap into that, right? You've gotta tap into their personal experience with your personal experience, right? And then the third thing is that instead of trying to get really specific in the really nitty gritty, you've gotta find those places of shared common values, right? We have to keep this on the high moral ground of what we're fighting for, right? And what we're fighting for is making sure everyone has health coverage, right? It's on the list behind me, right? That it is truly affordable, that it's comprehensive, that everything is covered, and that there's justice in it, right? That it's the same for everyone. And so when we can talk in these big, broad, sweeping strokes with folks about where we're trying to go, that generally helps us move people's hearts and minds along there with us, right? And so those are a couple of the things that I knew I wanted to get out. So I thought I'd just share on my first question everything that I had prepared to tell you. So, recapping, tips for advocating, right? Tailoring it to our audience, making it personal to you so it's personal to them, and then finding those shared common values that you have and that they have. And then I'm gonna give it to Philip to talk about his ideas for combating the resistance, as it were.
So we know it's going to take enormous mass grassroots pressure in the next couple weeks is Representative Pramila Jayapal from Seattle, Washington, is going to be introducing a new and updated Medicare-for-all Act of 2019. We need to put pressure on all of Congress, but we're especially putting focus on 24 members all across the country who are members of those two committees, who are Democrats who did not co-sponsor the previous HR 676. And in California, we have 4 of those members. There's Nancy Pelosi as the Speaker of the House. She's one of the focuses. Scott Peters in San Diego, Tony Cardenas in the San Fernando Valley, and Raul Ruiz in eastern Riverside County. And with California probably being the most important state in the primary now because of the earlier primary, we have an opportunity to really elevate this issue even more. And it's already been elevated by Bernie last time in the 2016 campaign. Medicare for All has never been more popular. 70% of the American public supports Medicare for All, and people are realizing that this current broken, fragmented system, this profit-driven system is failing way too many people who can't get the care that they need. So what we have to do is we have to translate that support into grassroots pressure on our members of Congress. So please call your Congress member, even if he is a Republican up here. It's worth reaching out to them. They're supposed to represent us. At this moment, in the next few weeks, it's a really key time period to get as many original co-sponsors on the Medicare for All bill, because it hasn't been introduced yet. It'll be introduced in a couple weeks. So right now is the moment where they're trying to get as many original co-sponsors on the bill. So please call your representative.
There's one particular issue in persuading people about this that I think would be interesting to hear your thoughts on. All the evidence shows us that single-payer healthcare, Medicare for All, whatever we want to call it, both costs less in terms of its cost to the nation as a whole, and it also costs less to individuals. We finance healthcare now in a whole array of different ways. People would be paying less for their healthcare than they would in taxes. But if you tell them that they have to pay taxes for it, that they have to pay more taxes, somehow there's just an extraordinary level of resistance to that. Somehow paying for it in taxes, people are more resistant to that than paying for it any other way. And I'm just wondering, thoughts about how you talk to individuals about that concept.
I experienced this firsthand every single day last year, right? My entire campaign, my opponent's entire campaign against me was, she's gonna raise your taxes, right? And I wasn't gonna raise their taxes, right? I want your taxes. I want to reinstate fairness to our tax code, but there is something so visceral about the government taking more of our money, right? And why is that? Why is that feeling? Right? I think we have to keep asking ourselves these questions, and for most people, I don't want the government to take more of my money because I don't trust you to do it right? I don't trust you to spend my money the same way that I would spend my money. In a lot of these cases, we have to take the logical, straightforward, factual-based answer out of it and come up with how do we move people's hearts by telling them stories, right? How do we share with people meaningful examples that will open their mind to a new way of thinking? Because that for me is really the crux of this whole issue. How we get this done is we build up the political will to say it's okay that I have slightly more taxes because I know at the end of the day my healthcare will be less expensive. I was up in one of our northernmost counties it was the dad of a former student in one of our northern counties, and he said, Audrey, I like what you have to say about infrastructure. I like what you have to say about career tech ed. I like what you have to say about making our forests healthy. I like what you have to say about agriculture. I like what you have to say about water. But I can't get behind this whole Medicare for all thing. Can't get behind it. Can't support you. I like everything else on your website except for that. And I said, listen, John, all I want is to make sure that we have a healthcare system where no one goes bankrupt because of a health crisis. Can you get on board with that? And he's like, yeah, I can get on board with that. And I was like, John, all I want is that for me to walk into a hospital with good insurance, and for you to walk into a hospital with bad insurance, I want us to get the same quality of care. Can you get on board with that? And he was like, well, yeah, I can get on board with that. I was like, John, what do you want out of a healthcare system? And he said, well, I'd like to not have to pay $4,000 in premium a month for my family. And I said, you pay $4,000 a month in premiums? Why did we not start there, right? And so it's finding that connection, you know, and it is person by person work, and it is long work, and it is grueling work, and it is building the trust and the rapport and the relationships with people who think differently than us about this. And that is how we move the needle. But it is not done by me, and it is not done by Philip, and it is not done by David. It's done by every single one of us looking for people who have different thoughts than us and engaging in them in real meaningful conversations and listening to what they need and what they want. And that's how we move the needle.
Yeah, totally. And I think the tax argument that sometimes people might bring up is really easy to overcome because the facts are so much in our favor. We pay more than twice as much per capita compared to every other country out there. People are just, you know, these insurance companies are bleeding us dry. Nobody likes them. A little bit after the general election and after Trump got elected in 2018, Bernie did a town hall in a county in West Virginia, and it was a county that went 70% for Trump. And it was a forum on healthcare, and he was talking to these folks there, and basically, you know, as he was getting into it and talking about healthcare, he had the whole crowd, including a lot of coal miners who had voted for Trump, basically cheering for Medicare-for-all, because people wanted there to be guaranteed healthcare for everybody as a human right. And so I think this is such a political opportunity. Democrats need to go out there and be putting forward these really bold solutions like Medicare-for-all and a Green New Deal and a guaranteed jobs program. If they're not, I think they're just being politically stupid because this is such an opportunity. If you look at the issues, this is where most people side.
This question will segue just a little bit wonky, but not too much so, I hope. One of the things that happens in our healthcare debates and in legislation is various people put forward incremental steps that are small steps in the direction of getting more people covered. And so a lot of times these incremental steps are really put forward as ways of blocking progress towards single payer. They're alternatives, they're distractions, and they're really not intended as steps on the road to single payer. But we also know that some of the single payer countries kind of got there in an incremental fashion. Canada moved province by province, for example. France, as I understand it, kind of moved one economic sector by sector. One of the things that a lot of people think is that if rather than making an abrupt all-at-once transition, we could make some kind of a step-by-step transition. Are there ways to do that might actually be steps in the right direction that you can think of?
What we're going to see, and this is already happening on the federal level anyway. Oops, sorry, check. Okay. So what we're going to see, and this is already happening on the federal level, is as the movement gets more and more powerful, and as Medicare-for-all becomes basically, it's becoming a litmus test to be a progressive Democrat. You have to support Medicare-for-all, and that's an amazing thing that we've come this far. But what more centrist and corporate-leaning folks are doing, backed by insurance companies, is they're putting forward these corporate half measures that don't fundamentally fix the problem. If you're putting forward a policy that leaves intact this fragmented system of for-profit insurance companies, that's not a real solution. It's not what we need. So I think it's really important that we don't fall for that and we keep pushing for the real deal. A public option is not going to work. What's going to happen there is the insurance companies are going to cherry pick the healthiest patients, and they're going to do everything they can to make the public option fail so that it can't be expanded to full Medicare for all. So what we want is a true single payer program, and we shouldn't compromise on that.
So I'm going to bring you back to where I think we need to go. Right, and I agree that I think the gold standard is Senator Sanders' bill. I think that is what we know will work, right? We know that a truly single-payer system will save lives, it will save money, and it will keep us all healthier. It'll allow us to focus on prevention, right? But I think President Obama said it the best when he said, we don't want to let perfect be the enemy of good. And I will support bills like Senator Sanders' bills, and I can see myself supporting a lot of other bills that get us closer. But I want to make sure that as Democrats leading up to 2020, we're having good faith discussions about this, right? Where we're having discussions that are based on we all know that this is where we want to get. We all know that this is going to be best for everybody. And having the discussion saying like, hey, calling out the money in politics issue, like saying, hey, like if you're trying to put forward a bill that doesn't get us there or gets us only partway there, why can't we get all the way there and show us your FEC records? And are you bought and paid for by Big Pharma? But every time I've had this conversation with people, I always say, I'm pragmatic and I want to move us closer and I want to get us closer. Ideally, in 2020, we have a Democratic president and we have a Democratic Senate and we can actually pass this thing through. But in the meantime, once you elect me, I'm going, if I was running again, I fell into old candidate mode there. Did you see that? That was weird. Hypothetically, if I was your representative, there would be a lot of things that I would support in order to get us closer there. Because I want us to get to a place where everyone's covered, where it doesn't bankrupt us, where everyone's getting quality of care. And I want to get us there as quickly as we possibly can.
Rural areas, remote rural areas, have a real need for hospital-level healthcare out there. People get hurt, people get in car accidents, people have heart attacks, things like that, and they need hospital care close to where they live. And yet, under our current system, small rural hospitals really can't survive financially. And yet, it's these very same areas that have those needs that are most resistant to making that kind of change. That's where we find the most conservative people who are most resistant. So I just wanted to sort of offer the opportunity for any more that you wanted to say around those issues in particular, around things that you've seen in your campaigning about the unique needs of this area, and also about how we talk to people about those needs.
We struggle here in Chico, finding primary care doctors, finding specialists, but boy howdy, as soon as you get outside of Chico and into the more rural parts of the 11 counties that I hope to represent one day, it's rough, right? It's rough. There are 2 counties, Modoc County and Sierra County. Women can't deliver babies in hospital facilities. There aren't the facilities to do that. Right? And so they have to drive hours and hours or move into someone else's home when they're getting ready to have a baby. When I had that cancer scare in August, and I had to go to Eugene, Oregon to have my surgery done because there wasn't a gynecological oncologist in our 11 counties that could have performed that surgery for me, right? And so we have a crazy health professional shortage area. Almost all of our district is medically underserved. And so when we start that way, when we acknowledge that and say, hey, I'm having a terrible time finding a doctor in Chico. What are you doing in Susanville? They'll say things like, well, hey, in Susanville, we used to have 2 doctors and now we're down to 1 doctor who's here every 2 days, And so when you can start with, what's your experience here? What's it like for you here? Do you have enough doctors? Do you have enough specialists? Because we all know the answer is no. Then you listen and you say, hey, what could a system look like where we could have enough doctors, right? How could we recruit and retain enough doctors? How could we make sure that a system was designed to make sure that they were getting reimbursed at adequate rates out in more rural and remote rural areas, right? And so by asking them those questions and having those discussions, but by hooking them with something they care about right away, for me, that's where I found the most success.
Yeah, definitely a big issue in rural areas, especially. Not enough hospitals, not enough doctors, not enough primary care doctors. And so obviously Medicare-for-all, and especially the new bill that's going to be introduced in the House, I believe has a part of it where it sort of evaluates by region the medical needs, and it institutes global budgeting for different institutional healthcare providers. And so there will be a way to see what the needs are and to provide them for people that need them. What's happening in healthcare, along with every other part of our economy, is that it's becoming more and more corporatized and more and more conglomeration of industry. And so these hospital chains, as they grow and buy up these rural facilities and they grow, they shut down the less profitable ones, like the ones in rural areas where a lot of patients are on Medi-Cal, Medicaid, and the Medi-Cal rates are lower than Medicare rates, and so that makes it even harder to get doctors and to keep facilities open. So definitely we need a system that's not based on profit. Medicare-for-all offers that. It will offer funding for rural areas and for hospitals and doctors.
Right now, in the next little while, what are things, we have an audience here that are largely, to some degree at least, activists, many of them very much activists. What are things people can be doing in the short term to help move this issue forward?
So coming up really soon here, starting next weekend, is basically the launch of our national Medicare for All campaign focused on the Medicare for All Act of 2019 in the House of Representatives. Pramila Jayapal is going to introduce it in a few weeks. And so what we're doing is we're doing these barnstorms all over the country. There's, I think, 130 of them all across the country. If you go to Medicare-for-all.org, that's with the number 4. That's Medicare, the number 4all.org. You can look at the barnstorm closest to you, and there's going to be subsequent canvases and other activities for people to get involved in. They're all going to be posted on the map there. And in California, we're going to start seeing these candidates come here, and they might even come up here. So I would just be totally bird dogging all of them to support Medicare for All.
That's great. I have one idea and tip. It's kind of weird and non-specific, but when I've started a new goal, or when I've started to try to do something more, and whether it's advocate for something like we're doing here or something else in my life, I found it very helpful to make a short-term win, to make an actual written plan and give myself a short-term goal. And so if you are feeling fired up when you're leaving here today and you said, I want to step up my advocacy game, what is one short-term win that you can do, that you can get, that you can accomplish in the next week or the next month that'll help make you a better advocate or help make sure that you do advocate? Right? And so that would be my tip, and maybe it's signing up for the Barnstorm, maybe it's signing up to Canvas, maybe it's looking up this Universal Healthcare 2030 guide that the World Health Organization put out, maybe it's making a social media post or calling up a friend who doesn't know about it. There's a lot of things that we can do that are concrete, actionable things that will give you more courage and more confidence in advocating, but also just help make sure that we're all actually working and planning to make it happen. So.
One more thing, here in this area you have Doug LaMalfa. He's a Republican. He has said he doesn't support Medicare for all, right? It's still worth reaching out to him and going out there in the community and canvassing, knocking on doors, talking to people about healthcare, sharing healthcare stories, because you're growing the capacity to eventually be able to unseat him, and you have to keep growing the movement no matter whether it's a Democrat or a Republican in office. But if we are able to actually flip the first Republican, that would be such a huge deal. So, keep working on him, but also support, progressive alternatives out there. And when you're canvassing, it's important to know that a lot of, the healthcare canvassing that we're doing on the Medicare for All campaign, we're trying to make it a little different than your typical electoral canvassing, because we wanted people to have in-depth conversations at the door about healthcare, and we're talking to everybody, Democrats, Republicans, Independents. And what we're finding is that almost everybody has a healthcare story. They've been affected personally, someone in their family, a friend, a neighbor. And so if we're able to go there and ask them about their story and let them speak their mind, and even let them speak their mind if they disagree. Like when you come across somebody who disagrees with you politically, the last thing you want to do is just, spit back a bunch of statistics back at them. That's never going to win them over. What you have to do is listen, and then connect and see how that story connects to what you're trying to push for. In this case, Medicare for All.